Board overview for teletracking. In this video, we'll give you a brief orientation of your whiteboard view. To log into your whiteboard, it will remain defaulted to your ward view all day. However, it will freeze after a period of inactivity, in which case it will ask you to input your payroll number. This means that when you go to make a change, an automatic keypad will flash up and it will ask you to put in your payroll number to proceed to make any further changes. Logging in on your desktop or your iPads should be normal, straightforward as well. You would just log in using your normal hospital username and password and then be able to access teletracking from there. So these are the beds as set out in your ward. You have your green, clean, empty beds. You have your orange occupied bed. And you have your brown, dirty bed. There will also be a few other bed colours as well. Please reference the quick reference guides to refer to these. These will be for cleans such as Terminal Plus, Terminal Cleans and Stat Cleans. This column here, this is your new patient column. So the cell will appear blank and you can click once to indicate that this patient is now new. Pause, click again. This patient is now a new patient and this indicates the consultant needs to see them first. This column here, this ST column, this is the status of your patient. So you can see here, this patient, this yellow IH symbol, is an inpatient in your ward, whereas this patient is awaiting a pending transfer out. They're white because the bed hasn't been assigned yet. When the bed has been assigned, this will turn green. Here is the name of your patient. Again, most of this information should pull through from your EPR system. Age of your patient. Pink for female, blue for male. This is the milestones column for discharge and transfer. To display the milestones on your view, you should click once in the cell and make sure you have ticked the display milestones options. This will now display the progress on your screen. So you can see here for these milestones, you have milestones for transfer, like this patient here, and for discharge. So none of these transfer milestones have been ticked off, so this bar is completely yellow, whereas some of these discharge milestones have been ticked off, so this bar is partially green. The bar will fill up and become more green the more milestones you tick off. This bar is also partially red as there is a delay because the discharge threshold has been exceeded. To edit this, again, if you click on it, you can tick off as appropriate as you go through and select any delay reasons and any notes. This is your EDD column here. Again, we'll filter through. Isolation type will filter through. Consultant will filter through. New score will filter through here from your current OB system. This one here is your senior clinical review. If the cell is blank, it means that they have not had their daily review yet from the doctor. Once they have had their daily review, this can just be marked to indicate this has now been completed for them for that day. Icons such as these and these should be cleared manually at the end of every day. This column here is your red to green. This also should be cleared manually at the end of each day. To adjust my red to green, I'm going to click once in the blank cell, and I'm going to tick the areas of the actions that are still not completed for that patient for that day. Perhaps they are waiting on a new care package. I would select that. I can select more than one if I wish as well. And click Save. This patient is now having a red day, and I can hover over to see the delay reasons. Once that action has now been completed for the patient, I can tick off. And once all actions have been completed, I can tick green and save. They are now having a green day. This column here is your clinical criteria for discharge and also your acuity. These can be adjusted as appropriate in here. These columns here are for your blood, X-ray and TTA results. Now this won't display actual results as this is not a patient information system, but what it will display is an icon to show that those results are now ready. This will be a red, amber, green system. Red for not ready, amber for in progress, and green for complete and ready to pick up. Again, this is for your bloods, X-rays and TTAs. This will filter through automatically. This is the nurse assigned column down here. So you'll be able to see the nurse assigned for each patient. So you can see here that Peter has been assigned for Bay 3 bed E and Bay 3 bed F. This will be manually inputted by the nurse in charge every day. This column here, LOC, stands for level of care, in other terms speciality. Again, this should filter through. So we have medicine, critical care, etc. This column here is your ready to move column. This is something that will be activated when the patient is ready to move after a bed request has been made. This means that the patient is completely ready, all checks have been completed, a porter would in theory be able to take them and wheel them out the door. This also signifies to Control Centre that the patient now needs a bed assigned. It can be clicked as so, and it will start an automatic timestamp to time the transfer process. This is the target ward, so this will appear when transfer processes are taking place. This is the assigned bed column. This means that the new bed the patient is moving into in an intra-ward transfer would appear here. This column here is the length of stay column. This shows how many days and hours they have spent so far in hospital. This column here is your real-time location system badge column. The patient badge, once attached to the patient, will display with the number as so. This again is your badge opt-out column. This can be marked to indicate if a patient has refused to be badged, like so. However, the patient should not really refuse to be badged, as this is an implied consent basis. We are assuming they're saying yes. If they do say no, it is advisable that the badge is still scanned on the system, but alternatively placed around their bed or in their notes. This column here is for ordering a porter, and again the icon will be displayed in here when a pending job has been made. This is the current location of the patient, and this will be updated as such, particularly when portering takes the patient. So the patient is currently in Bay 3 bed A, and they haven't moved from their bed, so this is their current location. If they move to X-ray, this would say X-ray, etc. Also, to point out, this little small number here, this is a priority. Although Control Centre is now assigning the beds, clean, green, empty beds can be prioritised. If I click on this, from 1 through till 9. These are priorities, so Control Centre knows which beds they should fill first. Priority 1 is ideal bed. This can be marked for more than one bed. Priority 9 is your last resort bed. Maybe there's a bit of equipment around it or an agitated patient. To adjust the priority, you would just click on the appropriate one. Now this bed is priority 9. Also, there is a ward board rounds tab. This ward board rounds tab looks exactly the same as the other tab. You can see the columns and the rows as such. The main difference here is that you have your therapies columns. This POS here. Physio is here. Occupational therapy. Speech and language therapy. These can be adjusted to indicate progress of therapies for the patient. For example, if I click on the physiotherapy column, if a nurse has made a referral, they can click Requested to indicate to the physiotherapist that this patient needs to be seen. When the physiotherapist is seeing the patient, they can move the icon to In Progress, and when they have completed treatment, they can click Completed. Select any delay reasons and any notes. Click Save and Close. This has now been updated. If we go to the icons at the top here, this staff assignment icon, this is something that the sister in charge would click on to assign staff manually. This icon is the item transport icon, which can be used for ordering any medical equipment, bloods or medication. This here is your Instant Notify icon. If I click on this, this works like an instant messaging system. You can select to send a message to specific users if any issues occur. For example, portering, bed cleaning supervisor, or Control Centre. Select at the top who you wish to send it to. Type in the message as appropriate and click Send. Your message has now been sent. Also here is the ward message board. Multiple messages can be inputted in here by the sister in charge. Click Save and Close. And you'll now see that up to 5 rolling messages can be displayed in the banner at the top. Finally, the icon at the top here is this Quick Reports icon. I can click on any of these to run an instant PDF on staff assignment, the staff that have been on that day, length of stay, the length of stay of the patients for a particular period of time, Instant Notify, the messages that have been sent using the instant messaging function. If I click on this Care Support tab, I can go into Transport Tracking, which will give me more detail of my transport history, and here is also where I can further order porters or items. This is my Alerts button at the top. This will flash red if there are any changes in my ward. I can click on it when it is red. At the moment I have no screen alerts, but messages would display here and I would click Mark as Read as appropriate. To set up my notifications so that I receive the alerts in the first place, I would click on My Notifications, and my screen alerts should previously show up as disabled. I would just click them to enabled. I would only have to do this once when I first log on. This means I will now receive alerts. End of video.